Let's discuss the pathophysiology of anemia of chronic inflammation. Now, you may have heard anemia of chronic disease more than anemia of chronic inflammation. The reason I have used this term here is the underlying mechanism for anemia in chronic disease is inflammation. This inflammation releases interleukin 6, which starts the whole process. That is why I prefer to call it anemia of chronic inflammation. When does this usually happen? When you have any autoimmune condition, infection, or malignancy, this causes the release of interleukin 6 and it starts the whole process. So, why does anemia of chronic inflammation develop, or how does this happen? In anemia of chronic inflammation, iron gets trapped inside the cell. So despite having enough iron, it cannot be used for the synthesis of hemoglobin. But how does this process take place and what regulates this? In order to understand this, we have to look at this picture one step at a time. So the iron that we get usually comes from the food iron. And there are two forms of iron we get from food. We call that heme iron if it comes from the hemoglobin, and non-heme iron for all the rest of the iron sources. The way these two forms of iron are absorbed are slightly different. Heme iron is absorbed via heme transporter, whereas non-heme iron, which is usually in the ferric form, needs to be reduced to ferrous form first, and then after that it is absorbed through a special type of transporter present on the cell membrane. Once the iron is inside the cell, two things can happen. One, it can just be stored as mucosal ferritin unless it is used for some other purposes, or it can be transported to the blood. In order to reach blood, it has to go through a transmembrane protein called ferroportin. This ferroportin is regulated by a special enzyme secreted by liver, and we call this hepcidin. And you can see the word hep in the beginning of hepcidin gives us a clue that it's synthesized in liver. In anemia of chronic inflammation, when the interleukin 6 level goes up, it also increases the level of hepcidin. Hepcidin prevents ferroportin from transporting the iron across the membrane. So, when the hepcidin level is high because of the inflammation, iron cannot come out from the cell, and because of that, cannot be transferred by plasma transferrin for the synthesis. And despite having enough iron inside the cell, body cannot synthesize hemoglobin by using the iron. And that's why anemia develops. But what is the benefit of this? Or why does this happen? Although we do not know for sure why this happens, one of the hypotheses is that the enzyme hepcidin is similar to defensin in its structure. So scientists assume that body is actually trying to protect us from the invaders. And one of the examples they often cite is Haemophilus influenzae. This bacteria requires iron for its optimal growth. And by limiting the amount of iron present in blood, body is trying to protect us from letting this bacteria grow. So perhaps this is one of the reasons, but we do not know for sure, as I told you. So this is the pathophysiology of anemia of chronic disease. If you think this video is useful, please hit the like button. And if you don't want to miss the videos in the future, do not forget to subscribe to our channel and share it with your friends. All the best.